Hi, Dr. Avula. My name's Noah Steyer.
All right, now.
Good. How are you?
Good.
Hi, I'm Cassidy Dozier.
Hi,
And,
Cassidy.
and hi, my name is Ingrid Ramos.
Great to great to meet all of you.
So we're all members of the Riley Institute's advanced team, and so we're a group at Furman University who are interested in government and public policy. And I think we all agree that we kind of wish we were on campus right now to hear a lot of the engaging speakers that the Riley Institute brings in. But we're inviting some past speakers into our homes to get their unique perspectives on COVID-19 and how it's impacting various sectors of people's lives.
Today, we are joined by Dr. Danny Avula, who is the director of the Richmond and Henrico Health Departments in Virginia. Dr. Avula previously joined us on Furman campus for Riley Institute's StraightTalk series on the working poor and poverty in 2014. We're so glad to be able to speak with him today.
Dr. Avula, thank you so much for taking the time to talk to us. We hope you and your loved ones are well and safe.
Thanks, Ingrid.
So, first off, we'd like to get a sense of how Richmond and the surrounding areas is faring in the face of COVID-19 compared to the rest of the United States. What can you tell us?
Well, the first case in the state of Virginia was back on March 7th. So compared to a lot of parts of our country, kind of on the later end of a serious outbreak. And things moved pretty quickly. I mean, we definitely saw a pretty significant spread of disease. I think where Virginia and many other states were hardest hit was in long-term care facilities, so nursing homes and assisted living facilities. Towards the end of March and the beginning of April, we had one of the most significant nursing home outbreaks in the country, and actually garnered a lot of national news attention because of that particular outbreak. But we've continued to see nursing homes and assisted living facilities be the primary place where individuals are passing away due to COVID-19. I would say, unlike places like New York City or New Orleans or Chicago, we have not seen huge volume of really serious disease. So our hospitals, by and large, have had plenty of capacity. I mean, so much so that about probably a month ago now, we opened back up elective surgeries, and most of the state moved into our phase one here in Virginia. And the phases look different in every state as people kind of map those steps out differently. But so, you know, I think that it has been hard hitting compared, you know, just like it has everywhere else, although not to the degree that we've seen in really densely populated areas.
Thank you.
Like many southern cities, Richmond is economically, racially, and culturally diverse. How have you seen, as a public health director, COVID-19 affect each population differently?
So I think that has been one of the most, concerning and compelling things about the way COVID-19 has impacted the entire country, is that we have definitely here in the Richmond area seen a disproportionate impact on our Black and Latinx populations. And we've seen that happen in other parts of the country as well. And, it's definitely, I mean, I think you take everything that's happening right now around police violence and our community's collective response to the really horrific events of the last few weeks. In the same way that those are events that are emblematic of a much longer standing underlying racial issue that our country has, I think COVID-19 is really illuminating those same underlying structural issues as it relates to racism and health disparities. And so the fact that Black and Hispanic communities are being more severely impacted by COVID-19 is not something that's unique to COVID-19. It's a reality that Black and Hispanic communities have worse underlying health status and are living in conditions where it's harder to effectively isolate and quarantine, and have longstanding distrust of the healthcare community and of government, where uptake of some of the social distancing guidelines, the advice that the CDC and the health department were giving out. There was just a lot of skepticism. And so I'll kind of make that practical for you all here in the city. At this point, we've had 24 deaths to COVID-19. And of those 24, 3 of them have been in Hispanic residents and 17 have been in African Americans. And so the fact that, 20 out of 24 of our lives lost to COVID-19 are in Black and brown communities, again, kind of just shows you the disproportionate burden that certain communities are bearing. And I do think it's a result of a few things, which we'll talk through real quick. One, the fact that exposure to this disease over the first kind of 2 months of the outbreak was really happening more in people who were dependent on public transportation or had to work frontline jobs where they were, a teller at a bank or a cashier at a Walmart or a custodian at some other essential business, right? The reality of those jobs still being in places where you were potentially exposed to other people put Black and brown residents of our city at higher risk for contracting the illness. And then you pair that with the reality that African-American and Hispanic residents have higher rates of diabetes or chronic lung disease or hypertension. And so the combination of having a higher risk of exposure with higher rates of underlying disease meant you were going to have more severe consequences in that community. We've also seen, particularly when we started doing our community testing events, when we actually went out into low-income communities and started testing, the community response was really mixed. There were a lot of folks who were saying, hey, don't come into our neighborhood and test us. We're not your guinea pigs. And that was really, an outpouring of this skepticism, this distrust of government and healthcare that has really been born out of decades and centuries of us not treating Black and brown people well, right? The fact that there are so many examples in our country's history, Tuskegee being probably the best known experiment, but there hundreds of examples of the way that we have dehumanized African Americans, and that has bred an inherent distrust to sort of large scale community health efforts. We see it every year with flu vaccination. There's a lot of resistance, particularly by the Black community, to get vaccinated by the flu. We've seen that be the case with COVID-19 as well.
Thank you.
And what have been some of the most challenging aspects of kind of implementing the public health response to COVID-19?
So that is definitely one of them. The fact that there just has been inherent resistance by the communities who probably need to hear the messages the most. And the fact that where people get their information from is so varied. And I think particularly in lower income communities, it's much more likely that you're looking to your neighbor or your social media feed than you are to the CDC or the state health department or the local health department. And so really trying to get credible information out there and drive people to reliable sources has been a big challenge, because people don't necessarily know what to believe. And so I'll just give an example. Our governor made it mandatory to wear masks. I think it was a week or a week and a half ago, something like that. And within a couple of days, there were these social media threads around that wearing a mask all day will lead to carbon dioxide poisoning. And so I think that our kind of innate response when we don't have good credible information is to just put stuff out there, to make stuff up, and that has can get a lot of traction really quickly. So one of the big challenges, Noah, was really like dealing with the information gap and trying to figure out how best to get information to the communities that needed to hear it most. I think some of the structural realities that I referenced earlier have also made our response difficult. In the city, over 30% of our cases are in our Latinx population. And that is really being driven by individuals who, may be exposed to work. We're seeing like large construction crews, we're seeing outbreaks in. We have factories where we have a lot of undocumented workers where we've seen outbreaks. And that those residents are getting sick. Because they're undocumented, don't have a lot of leverage with employers. And so there's no such thing as paid sick leave. There's no understanding that you need to be home isolating. So they're just showing up to work, and that is spreading the disease. And then when they go home, often what we see in our lower income undocumented communities is that you've got lots of people living in really small spaces. You've got 10, 12 individuals living in a 2-bedroom apartment. And so coming home and trying to effectively isolate isn't really realistic either, because it's next to impossible to actually isolate and not transmit disease to other folks in your household. So what we've been doing over these last few weeks is trying to identify those residents where it's really challenging for them to effectively quarantine and isolate, and then offer them the opportunity to isolate in a hotel. And that has been fraught with, again, like this inherent distrust of government. I would say it's a very different type of distrust with our Latinx community than it is with our African American community. Although it comes from the same place. It's the fact that, our history, and particularly right now, our kind of national stance on immigrants is not one that leads a lot of people to trust what the government is going to do for them. And so that has been a huge barrier. And we've seen a lot of significant spread of disease in those communities as a result of it.
Absolutely. And, kind of going back to what you said about, communicating, getting the right information out there. So we recently heard from the U.S. Ambassador to Liberia, Deborah Malik, and she kind of helped coordinate the U.S. response to the 2014 Ebola crisis. And, one of the things she said was that messaging and communication are some of the most critical elements of leadership in responding to these health crises. So, since this is such a new virus, and like you said, there's often conflicting and rapidly changing information, or sometimes just false information, what are some of the tactics that you've used to get people to trust what you are saying and the information that you're putting out there?
Yeah. I think early on, so for me personally, as the public health director, I took a lot of my cues from our national leaders. At the beginning of this pandemic, I felt like both Dr. Fauci, Dr. Birx, as part of the White House COVID response team, were very visible, and that was really helpful. I think it was really helpful for the country to have like a face and a voice, in particular Dr. Fauci, who was just transparent, like, hey, here's what we know, here's what we don't know, but we're going to be back here every day updating the public about the status of this crisis. And so really, and that has shifted, as you guys are probably aware, right? I think their ability to be out front and center and to be as transparent as they were initially and probably need to be moving forward has been different. But I as the local public health director here have really tried to do that. I recognized early on that having a face and a voice and a venue for credible and honest information was going to be important, because there are a lot of things that we don't know about this virus still. I mean, the reality is that it's only been like 4 months or something, maybe 4.5 months, that we've actually been able to watch and study COVID-19. And that's frustrating for people, right? Like, it is frustrating when I get up there and I say, hey, we're opening up, but nothing has changed in terms of our ability to deal with this virus. We do not have a vaccine. We do not have any effective treatments. And we don't know whether if you've had this disease, that you've developed any kind of immunity to it, And so that's not a message, particularly, 3 months into isolation, that people are going to hear. People are, like, we're all stir crazy. We want to get back to normal life. This has had such tremendous impact on all of our lives in every way. And so all that to say that I have tried to be as forthright and transparent and consistent as possible. For the first month of the outbreak, I was probably on every news station every single day. And I just think, like, again, the model that Dr. Fauci and others said at the beginning of this was to be present, consistent, credible. And so I tried to do that for our community, even when the news wasn't really that positive.
And apart from just COVID-19's physical toll, it's definitely made a big impact on emotional and mental health. How have you personally been able to cope with the pandemic, and what are some resources that others can look to help them cope as well?
Well, Cassidy, let me come back to that question, because there's another element of Noah's question that I don't feel like because I really just sort of talked about my role as a communicator, but I might ask you to reset that in a second. But as a health department, we have also continually had to think about who are our audiences, and what are the messages for this particular point in time, and who are the right messengers for that message. And that, that it's been such a far-reaching pandemic that we've had to have really different approaches for different segments of our community. And so some of the easy and obvious ways we did that were just by tapping, the radio stations or the TV shows or the locally produced things or the social media influencers who had reach in particular communities. But I think it is also, one of the things that we've historically done as a health department is really tried to raise up the voice of marginalized community residents. We, for a decade, have had a presence in our lowest income neighborhoods throughout the city. We started the community health worker program that exists in the city, and have hired residents of our marginalized communities to be our local experts on the ground. And so we've really relied a lot on their connectivity and credibility and expertise to be able to get good information to people. And it's not foolproof, because as I said before, there's been a lot of resistance and skepticism. But, we've stayed at it. I think tenacity has been a part of our success. And so we've just continued to do testing events day in, day out. Probably 3 times a week, we're testing in low income communities in Richmond and Henrico. And those testing events pretty consistently draw over 200 individuals. And so despite the hesitation and skepticism, there are a number of people who are coming out to get tested. And I think it speaks to the fact that we've just had to stay the course, and that we have relied on our longstanding investment in relationships, and through that have built trust in these communities. So sorry, Cassidy, back to you. The question is about the mental health and behavioral health impacts of this. And was the question really about what have I personally done, or or the impact more broadly?
More you personally, and just how we all can personally cope with what's going on.
That's a terrible question for me. I've been a horrible example of any kind of work-life balance for the last 3 months. And I think part of that is just the role, right? There's never been a time in public health, at least in my lifetime, that has had this degree of acute intensity. And so for the first month, probably, I was consistently working over 100-hour weeks. That has tailed off to 78 to 80-hour weeks, but that's still not good, right? So I don't know. I mean, I'll say a couple of things. One, I have an incredible wife and family, and they have just been so supportive through all of this. I mean, I think my wife in particular has just recognized that this season is going to demand something different of me and of the health department collectively. And she has shouldered the load at home. We've got 5 kids, and so that's a pretty big load. But I have been able to work from home a lot. So even though the hours are long, I do get these windows, I get 10 minutes to grab breakfast with the kids, or we have carved out, dinner time is pretty sacred space. So I think just maintaining some of those rhythms with family have been really important. I think for many of us, Zoom has just become the way that we communicate, stay connected to the world. And so I am on like 12 hours a day of Zoom calls, but that this season has also kind of reintroduced old networks of friends. And so actually one of my best friends from high school, his dad died of COVID about 3 weeks ago. And a bunch of our friends all joined on a Zoom funeral for him. But that then launched us into some successive Zoom calls where we've really been able to rekindle old friendships and connections, and that's been really fun. So I don't know. I mean, I feel like those are just a couple of the things. Trying to get outside. Our family did go for a hike this past weekend, but like trying to just have some windows of time and space where I'm not completely immersed in work, but it's been hard.
Yeah, thank you.
Well, another question we would like to ask you is, what is something we can do to help those who might be disproportionately impacted by the outbreak?
That was a tough question, Ingrid. So I think that part of what this pandemic has done for everyone is just shown how connected we all are to each other. Like I believe that all the time, but it's like there's no time where it's been truer than in the context of a communicable disease, where your decision to stay home, to keep your 6-foot distancing, to wear a mask when you go outside or out into public spaces, to wash your hands, like those actually have real implications for other people, for other communities. And so the most basic answer to that question is like recognize the impact that this communicable disease has on people of color. You know, it's not the same impact that it has on other communities. And so your behavior then, your commitment to those actions and to not spreading the disease even unknowingly actually has positive implications for communities of color or the elderly who live among us. So that's my first answer. And I think that answer has sort of taken on a different layer given the events of these couple of weeks and our society's kind of collective response to that. You know, it's been 5 or 6 straight days of what initially started out as rioting and has really progressed to beautiful, peaceful protesting. And so in that regard, I think standing in solidarity and doing it in safe and peaceful ways. And there's this weird intersection that I'm starting to get questions about, but doesn't protesting bring thousands of people together and spread COVID-19? Yeah, it might, but at this current point in time, that's got to be a secondary concern, right? I mean, I think the pain and agony that our community is feeling has to be front and center, and we've got to find safe ways for people to grieve what's happening together. And I'm actually doing a press conference with the mayor tomorrow, and this will be one of the things that I talk about is that you know, it is we need this time and we need this space and we need people to be able to be out and stand in solidarity together. It would be great if we could do that 6-foot distanced and wearing masks. But if not, what we'll do is we'll ramp up testing. We'll make sure that more people have opportunities to get tested, knowing that, this type of congregation has the potential to lead to more outbreaks. And so we just need to stand ready for that.
Well, and in addition, is there anything else that you would like to say or mention that we haven't asked you?
Yeah, I think that this has obviously been a really trying time, both with COVID and with race realities. I also think that this prolonged crisis has brought about really wonderful parts of humanity, right? Like there have been so many examples of people just being generous and thinking about how can I care for my neighbor in a different way. I mean, I'm on this neighborhood. We live in a pretty racially and socioeconomically diverse neighborhood, and on our our Nextdoor app. There have just been all these offers to like, hey, I'll do a grocery run for you, or hey, let's do a group dinner order, or just like very practical and tangible ways that people have been kind of reaching across some of those boundaries to support families who are really struggling. The school system's response here in Richmond has just been amazing. Like to see, for a historically under-resourced school system to move to the purchase and adoption of technology so quickly, and to try and very aggressively to start to close that digital divide. There have been other innovations in other sectors, like the degree to which telemedicine has become normal over the last 3 months. We've tried for a decade to get telehealth platforms up and running, and it's always been two things. One, the sort of challenges around protected information, HIPAA stuff, but then also around reimbursement and payment. And COVID-19 brought a context where like we had to switch to telehealth. And I think that has fundamentally changed the way that healthcare, mental health, behavioral health will be carried out moving forward. And so I say all that to say, Ingrid, that this crisis hasn't all been bad, right? There clearly have been terrible things with lives lost and disproportionate burden, but it has brought about both innovation and manifestations of like a generous human spirit that are really beautiful.
Well, Dr. Avula, we really appreciate your insight and time, and thank you so much for joining us today.
Great to be with y'all.
Take care.